Today's topic is all about the fastest way to heal hamstrings, because there's a hell of a lot of hamstring injuries in the cricketing world. James, in your county cricketing and international masters cricketing time, how many hamstring injuries have you come across?
Oh God, loads. Everyone pulls a hammy at some point. It's like it's just happens all the time, particularly at the moment. So this is like very topical because there's a few guys. Shout out to Hubby from Clydach, and then Evo from Cardiff at the moment who's suffering hamstring injuries. So it's very timely, very apt, and hopefully this will be beneficial specifically for those guys and anyone else who's pulled a hamstring recently or is likely to pull a hamstring in the future. So let's dive in, shall we?
Absolutely. So, should we look at some of the main causes of hamstring injury? One of which, as we talked about on the previous podcast, could potentially be dehydration, right?
Mm-hmm. Yeah. So a lot of injury, soft tissue injuries do start with dehydration. It comes down with fatigue as well, when muscles are overworking. I think that's a good way to put it. So yes, dehydration can impact it, but obviously it comes to the fact that, you know, if you are working harder for longer periods and you push your body when it's tired, and that just doesn't mean just from like exercise alone. It could be from lack of sleep the night before, which is a potential issue, lack of good nutrition, stress on the body from something that may have happened around time. So there's lots of mitigating factors that could impact why you're going to pull a muscle, but stress, tiredness and fatigue is a big component alongside dehydration. So in terms of the overlying factors, they impact what's going to happen, but there are underlying factors too within the body that may impact why you're likely or more likely to pull a hamstring. Now, I see this time and time again, particularly when we're stretching or trying to help cricketers warm up and do some dynamic work before game or even afterwards. Most of them can't touch their toes, right? So they think they touch their toes means they have tight hamstrings. Well, most of the time, it's not because you've got tight hamstrings you can't touch your toes.
Well, they have got tight hamstrings, but there's a reason why. Yeah, that's the symptom, not the cause, right?
Exactly, yeah. So it's a symptom. The tight hamstrings are clinging on for dear life because they're doing the work of other things that have stopped working. So life, everything else you can think about what's gone on is getting in the way. And it's common, it's normal, particularly in the older athletes we see as well, but more so in younger kids, because guess what they're doing most of the time when they're not playing cricket or doing sport? They're sitting down playing computer games, doing whatever they want to. So things and certain muscles stop working. So let's start I'm trying to go into completely as basic as we can to talk about this. We could go into a really geeky side of things, but let's just think about this. Most of the issues with hamstrings start with the core. I can do a party piece where I can help most people touch their toes within a couple of minutes by just activating their core and making it work in conjunction with their hamstrings. Okay, it's a very simple party piece. Ask me one day. I might even do a video on YouTube to help you guys very soon too. But the point is, if the core is not working, you may have a six-pack, but it doesn't mean it's working. So guess what takes over? Your hamstrings, right, Josh?
They've got to do all the stabilization work for you, right?
Exactly. That's the key word. They're doing the stabilizing work of the body. The core, it should be the stabilizing muscle. It's all power and everything emanates from the core. But if your hamstrings are tight, it's because the core isn't switched on effectively and not doing its job. Now, alongside the hamstrings, if the glutes aren't doing the work, guess where the stabilization has to come from? The hamstrings. So if the core isn't working and the glutes aren't working, we've got multiple issues going on here at once. Now, what goes with tight hamstrings is usually tight adductors, right? The muscles leading into the groin area, as I feel them up here in front of the camera now for everybody, right? So they get tight as well. So if you get overactive adductors, you've got your glutes aren't working, you've got tight hamstrings, this whole area of the body isn't functioning properly. And there's another bit as well, tight neck. So muscles around the neck, which are linked to the core, it's all part of the fascial lines in the body. If a lot of people have what we call forward neck posture, right? Which means these are overworking.
Again, phones, computers, like
exactly.
This.
So these aren't working. They get tight, they're inhibited, right? So this whole frontline system isn't working. Now, not saying all of these aren't working, but most of the cases they're all interconnected, interlinked. So the hamstrings, tight hamstrings, is just an issue. So guess what? If you're tired, fatigued, overworked, putting yourself through high intense workouts, and the body just said, no, do you know what? F you, I've had enough of this. I need to protect you because there's just too many things going on. Guess what happens? Pop. There goes your hamstring. Okay? So again, a lot of times, if people are traveling a long way to games, that's when something like this happens too, because the stress of the body and the actual position of where you've been sitting down at the cowl just exacerbates this whole thing too. So that's what we see from some of the causes of why hamstrings happen. I'm sure there are other reasons of what's going on as well, but these are some of the mitigating factors we see and we know about. This is why we test so rigorously to see what's working, what's not working when we work with our athletes. I hope I haven't gone over the top too much there, have I, Josh?
No, that was really good, and I think it's just something that people don't necessarily think about. The core, the glutes being weak, the neck, especially probably the neck. People never think about that because, as you say, they just think, "Oh, I've got tight hamstrings. I need to stretch my hamstrings," and then they're surprised when you might relieve the tension for a little bit, and then it'll soon come back because the body needs to feel safe. It's got to have stabilization somewhere, so it just tightens them all up again. So you've pulled a hamstring. The question is, what next? What do we do now, and how can we heal it? And in the past, we would have all said the old classic RICE protocol: rest, ice, compression, elevation. But over the past, I don't know, 10 years maybe, that's kind of been debunked a little bit, and they're figuring out that maybe icing, too much rest and too much ice stops the body's natural inflammatory healing process, so it's maybe not the best thing to do. So there was an article published in the British Journal of Sports Medicine, so not some crazy place out of the ether. It's actually a well-respected sports medicine journal about the Peace and Love protocol, which we've been using for the past 6 to 12 months. James, do you want to talk us? People might think we're crazy now. What's the Peace and Love protocol?
Yeah, peace and love. It's hippies back in the 60s now, isn't it? That's what we're going to talk about.
Exactly, that's what I mean. It's not some weird out there kind of thing. This is good stuff.
It is good stuff. And again, I think we've got to still use maybe RICE as an element. This is where it comes down to the individual treatment needed for the athletes involved. So we can't just say sweeping statements that RICE isn't the right thing to do. I think we've got to look at everything involved and treat the athlete in front of us when we're looking at these things. But let's talk through the Peace and Love protocol, and then let's talk about, because again, I can talk about, I've had hamstring injury. I've torn my hamstring once. I've pulled a couple of hammies on my left side too during my life, and this is how I'd approach going around it now as well. So let's go into the Peace and Love protocol. So peace. P stands for protect. I'm going to read off the sheet here from the British, the research paper here now in front of us. So P is for protect, limit movement for 1 to 3 days to prevent further injury and reduce bleeding. E is for elevate, raise the injured area above the heart to reduce swelling. Good luck raising your leg above your head if you want to walk around all day with that. A is for avoid anti-inflammatories. Now that's an interesting one. I think it comes down to personal preference list, but what they find when they suggest is these can hinder tissue healing, so they should be avoided initially. I think that's a good point there. So initially avoid them. C is for compress, apply pressure to limit swelling and bleeding. Type of stuff there is voodoo floss bands, stuff like that. You could potentially use compression shorts, a good pair of compression shorts here that can help.
Yeah, compression bandage, compression shorts, stuff like that. Voodoo floss is really good, actually, because just Google voodoo floss bands. You'll find a million videos on it. You keep it on for a couple of minutes and it's really, your leg will look like it's had an accident after you take it off. It's like it's gone tiny, but it encourages the blood flow back to the muscle really quickly, which is what you want, right?
Exactly. And then you've got E is for educate, inform the patient about their injury and the healing process to encourage active participation in their recovery. Right, so that is, okay, when the dust has settled, I think this is where we're going to start looking at soft tissue work and getting it back in it to release the tight knotted muscle that's happened and everything here, all the fibers that are going crazy inside the muscle. So that's what we're looking at to begin with. That's the P side of things. Then once we go past the initial stage, then we've got the love stage, right? When L is for load. Gradually introduce movement to promote healing and tissue strength. O is for optimism. Maintain a positive outlook to enhance recovery outcomes, because guess what? What you think affects how you recover, right? Really important. V is for vascularization, encouraging cardiovascular exercises to improve blood flow and aid healing. So again, in terms of hamstring healing, we're looking at light walking. I'd say light bike rides, potentially, at the later stages of the healing process. And A is for exercise. Continue with tailored exercises to restore strength, flexibility, and function. That is when we're starting to combine things together. What we don't want to do is go back to sprinting work under stress and load too fast, too soon when it comes to hammies, because guess what? You may think it's right. Go into a game situation when you're trying to run a quick 2, a quick single, or sprint to run somebody out, it goes again. So you've got to take a little bit of time when it comes to hamstrings, okay?
Well, again, it goes back to what was the potential cause, as we talked about. Is it a weak core? Is it your neck? Is it your glutes? So you got to start working on those things and training those things more specifically, potentially doing some specific glute work, maybe also adding in a bit of, specific hamstring work, Nordic stuff like that, to start strengthening the hamstrings as well.
And reintegrating and just retraining the brain how it approaches what your hamstrings are doing. Where are they in space and time within the body? So start integrating certain exercises that say, hey, this is a core exercise, not a hamstring exercise. So we start to integrate and get them all working together. The glutes, the hamstrings, there's all these things working together as one unit. So that's an important part of the exercise thing we've got to try and do. And that's a podcast that's not going to happen when we talk about that, because it just makes no sense over a podcast. It needs to be more about videos around that, I think, in terms of that. So let's look at this in a practical situation now. What would I do around the peace and love and rice protocol if I was having a hamstring issue right now? The first thing I would definitely do is let it rest, heal for the first 48 to 72 hours. Like it says, limit movement for 1 to 3 days to prevent further injury and reduce the bleeding. Right? I will make sure I elevate it when I can. I'll try and avoid anti-inflammatory to begin with, because that's part of the healing process. And I would wear my compression shorts. I wear high quality ones from Skins. You can get some 2XU ones if you want to, but they're super tight ones that help perform. I wear them on a Saturday too, to be honest with you. And that's the starting phase. That's what I would do to begin with and keep it super easy. After 48 to 72 hours, I would then go for soft tissue massage. I would find a really good sports therapist, a massage therapist, and I'd get them working into the affected areas. Not bludgeoning in the areas, right? I'd get them into the areas nice and softly to start promote the healing process and break down that torn muscle and those fibers. That's what I do.
What about a little bit of dry needling? We're both big fans of dry needling. Would you maybe use that?
Yeah, 100% dry needling, but I wouldn't do it straight away. Right, so I would again, I want to get back to being as healthy and as fit as possible. So I pull all the stops out. Right, for me, when I want to get treated, I want to be treated like a professional athlete. Sometimes professional athletes don't even get treated in the way that I'd suggest they get doing, because they haven't got time. The physios, they're good managing a whole bunch of teams. But I'd be looking at massage every 48 hours, right? Slightly, gradually increasing what we can do with it, and then towards the end of the week or 2 weeks, when everything starts to get better, then start to do dry needling to get into the muscle and get into the deeper muscles to get everything released and relax it off. But at the same time, I would start to focus on the areas around the hamstrings. Okay, so we don't have to go onto the hamstrings entirely for those sessions. Let's look at the glutes, let's look at the core area, let's look at the diaphragm, let's look at the hip flexors, right? Are they tight and inhibited too? Because if they are, these are the areas we're going to be focusing on to release. So when we get back to training into the love side of things, right, adding load on, these things are released here now, so we can retrain the brain to start handling the injury and dealing with this issue, so we can try and prevent it from happening again. Because guess what happens? The biggest predictor of injury is sight of previous injury. So the brain will never forget you've pulled your hamstring. We've got to retrain it to make sure it's safe so it never happens again. Or it's never not going to happen again. There's always going to be that risk no matter what happens when you play sport, but try and reduce the risk of it happening again. Minimize it, yeah. Exactly that. So that's how I'd approach dealing with a hamstring injury if I was to have it myself. And that's how but again, every individual is unique, right? You've got to treat the injured athlete in front of you, but that's how I'd do it on myself, to give you a practical idea of how I'd approach it to get me back playing cricket as fast as possible.
Absolutely, and I think we've had some good success, haven't we, with the peace and love protocol? It's good. It's going well.
Exactly. Exactly. We should get Cricket Matters Peace and Love hippie T-shirts printed, I think, now, as part of the whole process.
Why not? Why not? What we might not do that, but what we will do is I think we need to do a proper blog about the Peace and Love Protocol. Wouldn't you agree?
Yeah, I agree. A proper blog, compare how we do it. It's how we treat multiple other injuries as well. But yeah, I think we should definitely talk about this more. And I think we're going to talk more about injuries and coming back from injuries, because the more I talk to cricketers, most of them are broken right now. I think that's an area we've all got to help people out with, because there's nothing worse than not playing the Saturday or during midweek when we're injured. So how do we recover faster, and how can we share what we know over the years of being injured ourselves and also helping with athletes to get them back to the game? So yeah, I think this could be a mini series of injuries alone on the podcast that we talk about.
Definitely. So, guys, if you do are suffering with a hamstring injury out there, please do give the Peace and Love Protocol a try. I'm sure you won't regret it. And that is it for today. Please don't forget to rate, review, and subscribe. And if you would like our free training plan, then go to cricketmatters.com/train.
And just on another note, just to butt in on Josh's ending there as well, if you want to talk about your injuries or have any issues, literally go to strengthmatters.com, book in a strategy call with us, right? I speak to so many cricketers now who are not having a conversation about injuries with people who get it, but we do. So literally book in a 15-minute consultation or conversation strategy call with me, and I'm more than happy to discuss with you guys. You know, I may not be able to help, but I can point you in the right direction in helping it sorted, because sometimes you do need professional help. We're not physiotherapists or chiros, but we can point you in the right direction to get that sort of stuff done. So just bear that in mind. Injuries suck. We'll try to help you get better as soon as we can.
Absolutely. Until next time, guys.